Hi, I'm Amy Hesbach. I'm a physical therapist and canine rehab professional. I want to talk to you a little bit today about using heat and ice with your pet. Um, Heat. So, using heat might be a hot water bottle, might be a warm, wet washcloth, might be a heating pad, whether microwavable or electric. Um, When a pet has had surgery, especially orthopedic surgery, we might not use heat right away. We might wait until about day 2 or 3 post-op. The reason being is that we might not want to increase circulation to an area, but actually flush the fluid away from a surgical area. So usually we apply heat to a muscle, not so much to a joint or to an incision. And the application of heat might be 10 to 15 minutes, but we want to be really cautious about using heat, especially the intensity of the heat. Pets have more subcutaneous fat, so they might absorb a bit more of that heat. If they have a fur coat, especially a darker fur coat, they're likely to absorb that heat and keep it close to their skin. So we certainly want to avoid burns if at all possible. So if the heat is more intense, we might have to add more layers, maybe towels and things between that heat source and their body. And we might apply heat for a shorter period of time. I tend to use heat as a warm up, maybe before exercise or activity, massage, or passive range of motion. Again, heat is going to increase circulation. It may help to relax muscle tension, especially trigger points. And it might be a great way to recover from the day. Some pets are quite willing to use heat or to accept a heat source, whereas others are more likely to prefer kind of a cooler temperature on their body, whether they've had an injury or not. We compare this to ice. Ice we tend to use early after surgery or injury, maybe for the first 2 to 3 days. We do tend to use ice over a joint, over an area that has been injured, over an area of swelling or inflammation. Now, our understanding of using ice has changed over the years, whereas we actually use ice as well as heat to help to mitigate or to reduce pain and discomfort. It's less likely to have an influence on the healing process, except that healing can be influenced by pain. So if there is pain, then healing will be slowed and will be delayed. So if we can reduce the pain and control the pain, whether with heat or ice, medications, acupuncture, or physical modalities, we can actually help to promote the healing process and promote recovery. When applying ice, we do want to assure that there is something covering the skin, the incision, a wound, the body between the ice and the body. That might be a sheet or a towel. It might be a pillowcase, so on and so forth. You can use an ice pack. You can use a bag of frozen peas. You can use a mixture of rubbing alcohol and water and freeze that. There are many, many different ways of applying ice to the body. We do tend to use ice after exercise or activity, kind of as a cool down. We do know that ice vasoconstricts an area, so it reduces circulation to that area. We do not want to use ice for too long or too much, as we know that it actually might delay the healing process and might lead to the development of more scar tissue and less of a good, strong healing tissue. So we do know with both with heat and with ice, we have an increase in circulation, we have a reduction in pain, we have an improved comfort in the patient. We do know that with both, we need to be cautious and apply some barrier between the heat or the cold pack and the pet. Now, we have learned that rather than icing or ricing, elevating, resting, compressing, and providing ice, we actually are promoting a peace and love approach to injury. So when your pet or you have been injured, we want to protect the injured site. We want to elevate the injured site. We want to avoid anti-inflammatories or ice in that early period of time, if at all. We want to provide some compression. We want to educate the patient and the pet owner with regards to appropriate activity and use of the limb or use of that injured part after injury. We want to gradually load or stress that tissue, usually through therapeutic exercise, through physical therapy and rehabilitation. We want to be optimistic. So that psychological input really has a lot to do with the recovery process. We want to promote vascularization, so increasing circulation to that area. And eventually we want to promote more exercise and activity. Now, all of these things and all of these stages in recovery and interventions during recovery should be monitored and should be advised by a veterinary medical professional or a physical therapy and rehab professional. So I would advise you not to follow these instructions unless you've been advised directly by that professional. For more information, or if I can put you in touch with a physical therapy and rehab professional in your area, I would invite you to contact me through email, through social media avenues, Facebook, Instagram, as well as through Teachable. And all that information is here for you. Thank you so much. Have a great day and happy healing.